So I'm going to be repeating all of my opponent's claims. The first claim that my opponent said was that everyone should have access to healthcare, and that everyone today can, what she says is that everyone should have access to healthcare. And she also mentioned that everyone today can use the ER room, the emergency room, and that everyone can use it whether they pay for it or not. That only helps my negative case, which shows that people can get healthcare whether they can pay for it or not. They can just go into the ER room if something big comes up. People that cannot afford healthcare do have other options, such as Medicaid, sorry. Whether they can afford top-notch healthcare or not, it really isn't anyone else's problem. It's too bad that millions of Americans don't have health insurance. Millions of Americans also don't have a car. Should people with jobs provide those with unemployment jobs as well? Education is the root of this issue, not whether or not we can give out expensive healthcare. The more education one has, the higher income they usually have. The second claim that the affirmative makes is the Patient Protection and Affordable Care Act is not universal healthcare. I'm not going to be addressing this point, as she just is explaining pretty much what Obamacare is. The third claim that my opponent states is the third claim that my opponent states is that 62% of all bankruptcies in the U.S. are caused by healthcare costs. I do not refute this number in any way, and it is indeed unfortunate that the high cost of some components of healthcare have been a factor of some bankruptcies. Question to ask, however, is would these people have survived if they would not have had that care? Also, what was it that caused their bankruptcies? Did they have insurance? Were the procedures not covered? You can see why these are important questions. It is a completely different story if 100% of these bankruptcies are caused by healthcare costs, were things such as plastic surgeries. I would rather risk bankruptcy than be denied service from my government because there will not be a proper return on investment for how much longer I have to contribute tax money into the health system, which is what would happen if the affirmative had their way with universal health care. The point here is that we as Americans still have a lot more choice and options available to us, even if that choice is physically damaging, that others do not in other countries that have universal health care. The fourth claim that the affirmative makes is benefits from universal health care outweigh the negatives. And she goes on to mention preventative care, and that's one of the options. But preventative care is expensive. The government just freely handing it over to anyone, even if they cannot pay for it, it's not sustainable. The cost is gigantic. According to Emma Roberts from Livestrong.com, universal health care budgets usually demand successive levies from your year or taxes. No surprise, since they are funding literally millions of people, and some of them can't really pay. For some other countries, however, the system is not sustainable, especially in the light of aging population, which we also have here in America. Some provinces spend 40% of total annual budget on healthcare alone, and this is in Canada. Funding for other programs like education and infrastructure are continually gobbled up by ballooning healthcare costs. Wait times are also increased and efficiency is reduced with universal healthcare coverage. Also from Livestrong.com, some countries with universal healthcare struggle to sustain efficiency. Canada and Australia rank lowest, according to Commonwealth Fund study, and they both have universal healthcare coverage. And accessibility of physician appointments and wait times for basic medical services, as well as specialist care, tests, and elective surgery. Other efficiency issues noted by the study included Canada's propensity for misplacing medical records and tests. Another claim that my opponent stated was that healthy Americans are good for the economy. And of course, we all know that's true. But it is not healthy for the American economy to try to support a massive system that gives free handouts and bears the cost on the rest of American taxpayers. The government is really bad at running efficient programs. Take a look at the post office, which according to their own books has recorded a $15.9 billion loss for the past fiscal year. Now we'll be attacking the organization of the system. The affirmative states that each state will control their own healthcare system. But if you really think about it, each state having their own healthcare system will create a mess. Imagine people that move from their old state to their new state, and then they figure that they can just skip out and pay the taxes, but they still end up getting the healthcare coverage. Or what about people that travel from state to state and or from another country, and they just come in and they start using the healthcare coverage from here? They're not paying anything. Another thing that the affirmative statement would have in the universal healthcare system would be a 2% income tax for citizens across the board. So everyone would be paying this no matter how much income you earn. I think that's an unfair burden on healthy citizens to cover those that are unhealthy. However, since all citizens are not created equal, health-wise, universal healthcare could end up being unfair to health-conscious citizens. Smokers, for example, receive the same treatment under universal healthcare, even though their conditions are self-induced as non-smokers. Smoking-related illnesses like emphysema and lung cancer place an enormous strain on the system and are mostly preventable. A similar argument can be made for those that are overweight or heavy drinkers. In a universal healthcare system, people do not have to take responsibility for their own health or their consequences because of their bad lifestyles. Everyone gets covered and everyone shares the same cost. And on the other hand, the system today that we have does its job, especially with innovation. This is because an opponent will be saying that the healthcare supports entrepreneurship, and it does not. The system we have in America today supports competition. Competition rocks. We all know that. Competition fosters innovation. And according to Greg Duergarian from Staffing Talks, there's a reason that pharmaceutical and biotechnology are two of the fastest growing industries in the United States. Universal healthcare funded by the government would really hold back potential for new medical breakthroughs because the government would insist on sharing the breakthrough to detriment the company's profits. This would end up with the companies leaving the industry. No profit being made, no reason to invest. Competition in the medical community has done much to help support the American economy over the last couple of decades. So much that our GDP growth outpaces other developed countries with universal healthcare systems. It's a fair system that we have today. You get healthcare if you can afford it. If you cannot afford it, there are some alternatives. And the system we have today works on the basis of the American system, the free market. We're all happy that we have a free market and whatnot. Everyone talks about it every day. It also fosters competition. Companies want to make profit, and this allows them to make profit.